if you look at any hospital or any community, most people want to go to the nearest hospital. And most of our children are operated by district general hospital staff who are not trained to do children, but have to do children. So we felt that if we upscale that group of specialists like surgeons, anaesthetists and nurses in looking after children's surgery safely, we will then increase the impact so that children don't have to travel to major hospitals like tertiary level hospitals or level 5 hospitals for the simple surgery. They can do it locally because people are trained. So the purpose of this whole project is that children can receive safe surgical care closest to their home because their local hospital is now trained to do the work. Now we want to cascade it all in Kenya, going from county to county. So for the 5 counties that have come here, we'll then train up other 5 counties. So you can see the cascading, in fact.
So we've had a very good 2 days in Kiambu Hospital. The first day, we spent the morning where we discussed the general topics for children, and in the afternoon we divided into specialties. So we had the anaesthetists, surgeons and nurses discussing separately. And today we spent time in theatre. I think the most important aspect was that there was communication between different counties and between Kiambu and those counties, and discussion about how they could improve the care. And although these people who were here today are involved in care for children, I think it enhanced their experience and they really benefited from coming here to Kiambu and enjoyed it very much.
Kenya has only 20 pediatric anesthesiologists. These are the anesthesia providers who ideally should anesthetize all the children coming for surgery. The mortality, we call it perioperative mortality and morbidity for children in our country is very high. Both the Kenya Society of Anesthesia and the Society for Pediatric Anesthesiologists in Kenya, we have taken it on ourselves to upskill the people who are giving anesthesia for children in this country. So what we want is to work together with the physicians and the non-physicians to make sure that children everywhere in this country get safe care of anesthesia. I have loved working at Kiambu Level 5 Hospital.
For me, this was great. The highlight for me was having to go through simple scenarios that are common in our everyday practice, but using them to show people that you can make the best even with the few resources that we have.
We've really learned a lot and we take this opportunity to say thank you. We've gotten really, really good welcoming service here at Kiambu Referral Hospital, and we'd like to do this again.
And here at Kiambu Level 5 Hospital, we've been able to do we've been doing children's surgery. Pediatric surgery is one of the forefront of the services we deliver. And we want to thank His Excellency the Governor for equipping the hospital and making sure that us as staff, we have all the equipment we need and the facilities to offer these services. And courtesy of that is why we are able to host such a training, invite hospitals from other county to converge, see what we are doing. We learn from each other, they learn from us, and then they can go back and implement in their various hospitals. Thank you to the governor, the county administration, the health administration, and everyone for helping make this possible.